I want you to try something right now. Take one swallow, just one, and pay attention to what you feel at the back of your throat. Is something there? A heaviness? A coating that simply refuses to clear no matter how many times you have already tried this morning? And now I want you to consider this. You have probably been attempting to clear that sensation dozens of times every single day. And if I ask you to pinpoint exactly when it began, you might not be able to give me a precise answer. It arrived gradually. In the beginning, it was only in the mornings. Then it extended into the afternoon, and eventually it became so constant that it simply became part of who you are. You carry water everywhere you go. You have started avoiding certain foods. You have worked your way through every home remedy a friend, neighbor, or relative has ever suggested. And yet nothing has fundamentally changed. Here is what I need you to understand. That mucus is not random. It is not simply your body wearing down with age. Your body does not generate persistent symptoms without reason. Every symptom that lingers is your body attempting to communicate something specific. The question is whether you have been given the tools to interpret what it is saying. Today I'm going to give you those tools, because in my years working with older adults in the field of preventive health, I have encountered this particular symptom, persistent throat mucus, misread and mismanaged more consistently than almost anything else. People are offered lozenges, they are told to drink more water, they are sent home, and the actual underlying cause, sitting quietly beneath all of it, is never identified or addressed. That changes today. I am going to take you through 5 specific, research-supported causes of persistent throat mucus in adults over 55. And I am going to do something that most discussions of this topic never attempt. I am going to tell you which 2 of these causes are almost certainly operating simultaneously in your body right now, because they almost always are. And I am going to show you how that particular combination amplifies everything and makes the whole problem considerably worse. My name is DR.Michonne. I work in preventive health and senior wellness. My commitment to this community has always been the same: straightforward language, genuine research, and practical steps you can begin applying tonight. Before we go any further, I want to ask you something in the comments. Is your throat mucus at its worst first thing in the morning, or does it follow you throughout the entire day? Your answer to that single question tells me a great deal about what is most likely driving this in your particular body. Write morning or all day below. I read every response. Now let us begin, starting with the piece of biology that most people have never been told, and that reframes everything once you understand it. Your body generates mucus continuously, every hour of every day, without interruption. And that is not a problem. That is biology functioning exactly as it should. Mucus is the protective lining of your airways. It intercepts bacteria, airborne particles, and viruses before they can travel deeper into your lungs. It keeps the delicate tissue of your throat moist and resilient. In the complete absence of mucus, your airways would become dry, fragile, and exposed to every pathogen you encounter. Mucus itself is not what you are fighting. What matters is what happens to that mucus as the body ages. Here is something research has confirmed clearly, but that most people never hear from their physicians. Inside your airways exists a system called mucociliary clearance. The surfaces of your air passages are lined with millions of microscopic hair-like projections called cilia. Their sole function, performed millions of times daily without any conscious input from you, is to sweep mucus upward and outward, keeping it consistently thin and mobile so it never has the opportunity to pool. In a younger adult, this system operates quickly and efficiently. Mucus is produced and cleared almost before it has a chance to accumulate. But research confirms that as we age, these cilia slow down. They beat less frequently. And the consequence is that mucus, which would have been swept away in seconds at age 40, can sit and accumulate for hours at age 65 or 70. What this means in practical terms is that any factor pushing your body toward increased mucus production will strike harder and last longer in an older adult than in a younger one. That is not a criticism of aging, it is simply physiology. And understanding it is the foundation of everything that follows. The first cause is one I want you to pay particular attention to: because research consistently identifies it as the most frequently overlooked explanation for persistent throat mucus in this age group. It is called laryngopharyngeal reflux. You may never have encountered that term. Let me translate it into plain language. Most people are familiar with the classic presentation of acid reflux, that burning sensation rising through the chest after a heavy meal. But there is a quieter, far more deceptive version of the same underlying problem, one with no chest discomfort whatsoever, no obvious digestive symptoms, just a throat that will not settle, a voice that sounds rough first thing in the morning, and mucus that seems to appear from nowhere. Here is the mechanism. Between your esophagus and your stomach sits a muscular ring, a valve whose entire purpose is to remain sealed after you eat, containing stomach acid where it belongs. With age, this valve can progressively lose its tension, much like an elastic band that has been stretched beyond its capacity over many years. When it no longer closes completely, stomach acid travels upward, not merely into the esophagus, but all the way into the throat, the larynx, and in some cases into the nasal passages. Now here is the biological detail that makes this so significant. The tissue of your throat was not designed to tolerate acid the way the esophagus was. Even the most minute trace of acid contacting your throat triggers an immediate protective response. Your body floods that irritated tissue with thick mucus to coat and shield it. This is entirely logical from a biological standpoint, but when this process is occurring night after night while you sleep, you wake each morning to that familiar heaviness at the back of your throat with no obvious explanation, because there was no heartburn, no chest pain, no signal pointing toward your digestive system. Research published in clinical ENT literature shows that up to half of individuals with this condition report no heartburn whatsoever, only chronic throat clearing, morning vocal roughness, and mucus that begins accumulating the moment they open their eyes. Ask yourself honestly, is your throat meaningfully worse in the morning than it is by midday? Does bending forward seem to aggravate it? Has your voice sounded different upon waking? These are the characteristic signs of silent reflux. And in the action plan I will give you specific, practical steps that can begin producing a difference as early as tonight. One additional detail worth noting. If you regularly take anti-inflammatory medications for joint pain, ibuprofen or naproxen, for example, peer-reviewed research has established that this medication class reduces the stomach lining's natural protective barrier. That makes acid reflux, including the silent variety, substantially more likely to develop or worsen. If you take these medications regularly and your throat has been persistently symptomatic, please raise that specific connection with your physician. The second cause tends to arrive without announcement, which is precisely why it so often goes unrecognized. When most people envision sinus problems, they picture the dramatic version. Intense facial pressure, throbbing pain across the forehead, complete nasal obstruction. But in many adults over 55, chronic sinus inflammation presents almost invisibly. Breathing feels largely normal, there is no significant headache, and yet the sinuses, mildly swollen and producing modestly elevated amounts of mucus, are draining steadily and silently down the back of the throat, hour after hour, all day long. This is called post-nasal drip, and a 2024 study confirmed that adults in exactly this age range represent the primary population presenting with it. Here is the part that causes the most frustration. Many people managing this have been reaching for over-the-counter antihistamines for months, assuming seasonal allergies are the culprit, and there is a reason this approach consistently disappoints. Antihistamines temporarily reduce the moisture in mucous membranes, but they do nothing to address the underlying sinus inflammation that is producing the excess mucus in the first place. And dried, thickened mucus adhering to the back of your throat is frequently more uncomfortable than the original problem it was meant to solve. The approach with the most consistent research support is remarkably simple and genuinely affordable. Regular nasal rinsing with a warm saline solution. A 2025 clinical review published in the journal Medicina, examining evidence across a broad range of sinonasal conditions, concluded that nasal irrigation is an effective, safe, and low-cost strategy for both treating and preventing upper respiratory conditions, and it is widely endorsed by ENT specialists internationally. High-volume saline rinses work by physically clearing inflammatory mucus, reducing mucosal swelling, and supporting the ciliary clearance function we discussed earlier, the very system that naturally declines with age. The most important word in all of that is consistency. 1 or 2 uses produces 1 or 2 days of mild relief. Daily practice, applied correctly, produces cumulative and meaningful improvement over time. I will walk you through the exact method in the action plan. The third cause is where I see the most genuine surprise. Because when we begin working through what might be driving someone's persistent throat symptoms, their medications, the ones they have been taking faithfully for months or years, are simply not something most people think to question. There is a class of blood pressure medications called ACE inhibitors, angiotensin-converting enzyme inhibitors. They are prescribed many millions of times each year. They are effective, well-tolerated in most respects, and serve a genuinely important purpose. But they carry a recognized, class-wide side effect that is clearly documented in the research literature. They allow a compound called bradykinin to accumulate within the body, and in a meaningful proportion of users, studies report somewhere between 5 and 20%, that accumulation triggers persistent throat irritation and a constant impulse to clear the throat. Critically, this is not an allergic reaction. It is not something unusual occurring in the body. It is simply a pharmacological consequence of how the drug operates, and certain individuals are more sensitive to it in the throat than others. Here is why the connection is so consistently missed. The side effect can take weeks or even months to emerge after the medication is first started. So if you began a blood pressure medication 8 months ago and your throat began bothering you 6 months ago, the two events may never have been mentally linked, even though that exact timing pattern is precisely what the research describes. A large-scale study involving more than 27,000 patients found that adults over 65 had a 53% higher likelihood of experiencing this throat side effect compared to younger users. If you take a blood pressure medication and are uncertain whether it belongs to this class, your pharmacist can answer that question in under a minute. And if it does, there are alternative medication categories, ARBs, angiotensin receptor blockers, that manage blood pressure with equivalent effectiveness and do not carry this specific side effect. That conversation with your prescribing physician is worth initiating. The fourth cause surprises people, not because it is complex, but because it sounds too straightforward to carry real significance. Hydration. But let me give you the physiology, because this is not what most people assume it to be. Mucus is composed primarily of water. Its consistency, whether it flows easily or sits thick and adhesive at the back of your throat, is directly determined by how well hydrated the surrounding tissue is. The clearest way I can illustrate this: think of maple syrup poured directly from a cold bottle versus the same syrup left open on a counter overnight. Identical substance, completely different behavior. Your mucus responds to your hydration state in exactly the same way. Here is the aging-specific detail that makes this more than a simple reminder to drink more water. Research has confirmed that the thirst mechanism becomes considerably less reliable with age. A younger adult experiences thirst well before meaningful dehydration sets in. In older adults, that early warning system is blunted. You can be dehydrated enough to noticeably affect your mucus consistency and daily comfort without feeling particularly thirsty at all. Waiting for thirst to prompt you to drink means you are consistently operating behind the point where it matters. And a state of mild chronic dehydration maintained day after day keeps your mucus persistently thick and adhesive, amplifying every other cause we have discussed. A practical fluid target referenced widely in clinical nutrition guidance is approximately 30 milliliters per kilogram of body weight per day from all sources. Water, herbal teas, soups, and water-rich foods all contribute. But the behavioral key is intentional, consistent intake distributed throughout the day, rather than attempting to compensate when thirst finally appears. The fifth cause is one that receives almost no attention in conversations like this one, and that is a significant gap. Because for a meaningful portion of older adults managing persistent throat mucus, the origin of the problem is not in the throat, not in the sinuses, and not in the stomach. It is in the gut. Here is what the research shows. Your digestive tract and your respiratory system share regulatory pathways through both the immune system and the nervous system. The condition of your gut microbiome, the vast community of bacteria inhabiting your intestines, directly influences how reactive and how inflamed your upper airways are. When the balance of that microbiome is disrupted, a state researchers refer to as dysbiosis, it can activate immune responses that drive mucus overproduction in the airways. Not because anything is physically wrong with your throat, but because the gut is transmitting inflammatory signals that the respiratory system responds to. This connection, sometimes described as the gut-lung axis, is an active and expanding area of clinical research. Multiple peer-reviewed studies, including research published in the American Journal of Respiratory and Critical Care Medicine and the Journal of Allergy and Clinical Immunology, have confirmed that gut microbiome disruption can trigger immune responses that promote airway inflammation. Animal model studies have taken this further. When mice received gut microbiome transplants from subjects with chronic lung disease, those mice demonstrated measurably increased airway mucus production, establishing a direct causal link between gut health and what occurs in the airways. What disrupts the gut microbiome in older adults? A diet low in fiber and fermented foods, repeated antibiotic courses over the years, elevated sugar intake, and chronic stress. These are not unusual or exotic factors. They describe the daily reality of a very large proportion of people in this age group. A throat lozenge will not resolve a gut-airway axis problem. But you can begin supporting your microbiome through consistent, deliberate daily choices, and I will include that in the action plan. Before the action plan, I want to take a moment that I consider genuinely important. The overwhelming majority of the time, persistent throat mucus in older adults is benign. Exactly what we have been discussing: manageable, addressable, and not medically dangerous. But your body occasionally uses symptoms to signal something that requires professional evaluation rather than self-management. Please contact your doctor without delay if you notice any of the following: mucus that is consistently tinged with blood even in small amounts, swallowing difficulty that is gradually worsening, unexplained weight loss occurring alongside your throat symptoms, a lump or persistent swelling anywhere in the neck, or a significant change in your voice that is not improving over time. These signs fall outside the scope of today's conversation. Do not work around them. Now for the action plan. Tonight, stop eating at least 3 full hours before lying down. When you eat and immediately recline, your stomach is still actively processing, and the valve we discussed faces its greatest challenge, staying closed. 3 hours of upright time after your final meal is one of the most strongly evidence-supported behavioral changes for reducing nighttime silent reflux. Additionally, elevate the head of your bed slightly, not by stacking pillows beneath your head, which simply bends the neck. Place a firm wedge under the legs of your headboard or beneath the mattress. Even a modest incline enlists gravity to your advantage and meaningfully reduces how much acid can travel toward the throat while you sleep. Before bed tonight, drink a full glass of warm water. This supports overnight hydration and helps keep your mucus thinner, reducing the severity of morning accumulation. Tomorrow morning, before coffee and before breakfast, drink 1 to 2 glasses of warm water. This single habit costs nothing and immediately begins rehydrating your system while loosening the mucus that has accumulated overnight, before it has time to set the tone for your entire morning. It is among the most consistently reported impactful changes people make. This week, pick up a nasal rinsing device from your local pharmacy, a neti pot or a squeeze bottle system. Use water that has been boiled and allowed to cool to a comfortably warm temperature, not water directly from the tap. Add a small amount of plain salt and optionally a very small pinch of bicarbonate of soda, which may gently help thin mucus by neutralizing nasal acidity. Use it once daily, preferably in the morning. Give it a full 2 weeks of uninterrupted daily use before drawing any conclusions about whether it is helping. Consistency is the single variable that separates people who say it worked from those who say it did not. Schedule a conversation with your physician, specifically to review your medication list in relation to your throat symptoms. Come with a written timeline. When did the throat symptoms begin, and when did you most recently start or adjust a medication? Bring that chronology. If you take a blood pressure medication, ask directly whether it is an ACE inhibitor and whether an ARB alternative might be appropriate for your situation. To begin addressing the gut-airway connection, introduce one small daily serving of a fermented food into your routine. Plain yogurt with active cultures, kefir, kimchi, or sauerkraut. These choices begin diversifying and strengthening the gut microbiome in ways that research links to reduced airway inflammation over time. This is a long-range strategy rather than an immediate fix. But long-range strategies are the ones that genuinely shift your baseline. Set consistent hydration reminders. Keep water within reach in every room where you spend time. Incorporate more water-rich whole foods into your meals. Cucumbers, melon, broths, herbal teas. Your mucus consistency will begin responding within days. A brief word on the popular home remedies, because I know you have tried at least some of them. Honey is genuinely soothing for irritated throat tissue and is not harmful, but it does not address any of the 5 causes we have discussed today. Dairy does not generate mucus from nothing. The science does not support that claim. However, some individuals find that dairy proteins create a sensation of increased thickness in existing mucus. If you notice a consistent personal pattern, a 2 to 3 week elimination trial is a reasonable experiment. Apple cider vinegar is frequently suggested online, but for anyone dealing with silent reflux, introducing additional acid into the system can actively worsen the very problem you are trying to resolve. Exercise caution there. Here is what I want you to carry with you from today's conversation. That persistent coating at the back of your throat has a reason. 5 possible reasons, in fact, and most people living with this problem have never had a single one of them properly explained. Silent reflux occurring quietly overnight with no heartburn to signal it. Postnasal drip from low-level chronic sinus inflammation that never announces itself dramatically. Medication-related throat irritation, specifically from ACE inhibitors, developing months after a prescription was started and never being connected. Chronic mild dehydration running just beneath the threshold that triggers recognizable thirst. And gut microbiome disruption transmitting inflammatory signals that the airways are responding to directly. Not one of these requires you to simply accept a life of constant throat clearing. Each has a practical, evidence-grounded response. None of the first steps requires a prescription or a specialist referral. They require knowledge, consistency, and a decision to treat your symptoms as a signal worth responding to, rather than an inconvenience to manage around. If anyone has ever told you that this is simply what getting older feels like, I hope today gave you a different way of seeing it. Because you are not simply aging. You are dealing with specific, identifiable, addressable physiology, and you deserve to know that. Make sure you are subscribed and have notifications enabled. I have a video coming soon on exactly how gut health connects to the chronic inflammation patterns behind some of the most common complaints I hear from adults in this age group. A conversation you will not want to miss. If this gave you something genuinely useful today, would you share it with one person who has been quietly managing the same problem? That single share costs you nothing and could meaningfully shift how that person understands what their own body has been trying to tell them. And before you go, tell me in the comments which of these 5 causes surprised you most and how long you have been living with this. I read every response personally. This is a real conversation, and your experience matters here. I am Dr. Michonne. Take care of yourself.